As India launched its universal immunization program, already we have built it as, or rather, it's been billed as world's largest vaccination drive, that more than 200 people has taken shot on the first day itself. Well, the drive is expected to cover nearly a quarter of India's population in its first phase. But at the same time, there have been some reports of adverse reactions as well, though are on a much smaller numbers than these cases, which has been referred for medical opinion. They've been termed as nothing serious, and of course authorities are keeping diabetes. So clearly, our vaccination drive, as it goes on in terms of a smooth rollout, what we should look for. Well, to discuss further on this issue, we are joined by a panel of three important guests. Dr. Y.K. Gupta, he is National Scientific Coordinator, PI. Dr. Rana A.K. Singh, he is Medical Superintendent, RML Hospital, Delhi. And Dr. Harshvardhan Singh, he is Senior Resident of Community Medicine, RPGMC, Himachal Pradesh. Well, many thanks for joining us. Let me start with you first, Dr. Rana A.K. Singh. You underwent vaccination in the first phase of the mass vaccination drive this Saturday. Could you please tell your experience? Could you share your experience for the benefit of our viewers? What is the entire vaccination drive all about? Sir.
You see, I want to answer your question in two parts. First, why did I decide to get myself vaccinated right in the word go? And the reason is that being a healthcare professional, I am fighting with this corona epidemic for last 1 year. And we are seeing how difficult disease it is, how fatal disease it is, and how deadly it is. So, in spite of being in the middle of everything, I have survived over last 1 year of corona. But now I got the opportunity to get myself vaccinated. That means I got the opportunity to prepare my body to develop immunity against this deadly disease. Right. And I didn't find any reason why should I wait. So that is why I got the vaccine on day 1. So that my body starts, developing immunity against this disease, right at the earliest opportunity. So that is why I got this vaccine on day 1. And second, as far as my experience is concerned, I had absolutely no problem. The day I got the vaccine, the next day, and today is the third day, I got it on Saturday. No problem at all.
Right. Many thanks, Dr. Rana A.K. Singh, for your opening remarks. We'll certainly come back to you for more as we explore further dimensions of vaccination in the progress of this show. Dr. Harshvardhan Singh from Himachal also joins with us. He's Senior Resident of RPGMC. Many thanks, Dr. Singh, for being with us here. You also underwent a vaccination in the mass immunology program on Saturday. Could you also just share your experience with us before we open the show and include Dr. Y.K. Gupta as well? So,
yeah, thank you so much. I was one of the first 5 beneficiaries to have the COVID vaccine on the first day itself.
Right.
And as more than 48 hours have passed, and I have not experienced any of the adverse effects that have been reported for this COVID vaccine which I had. So some of my colleagues, a very handful of them, reported mild fever, but myself, I am perfectly fine till now.
Right. Certainly, that's very good to know. Well, Dr. Y.K. Gupta, National Scientific Coordinator, PVPI. So, as we talk about the rollout of our mass immunization program, which certainly has been fairly smooth in first 2 days, we are on the third day itself. If we talk of certain reports of the adverse reaction, so to begin with, what will you term adverse reaction, and are these things common for any vaccine? Dr. Gupta.
Important question, and it's very important, essential that all of us should understand what are the possible adverse effect which
Right.
can happen after a vaccine. See, if you take a drug and if you take a vaccine, there could be an adverse event. When you say adverse event, it can be adverse drug reaction or adverse effect due to vaccine. It may be totally unrelated to that because it may be several things which may be there. Now, what I would like to mention that a vaccine, new or old, when introduced into the body, it is expected that in some subjects, some volunteers or some patients, it may cause following reactions. It may cause pain at the injection site
Okay.
because of the prick. It can cause some more pain because of the drug or the vaccine itself introduced. It may cause some redness at the local site. In some, there can be irritation. In some, there can be minor or some degree of fever, which may not require any intervention, maybe no analgesic. In
Right.
some, there may be some headache, which may go off automatically or just after some time. In some, it may require minor medical management, maybe in antipyretic or analgesic. In rare situation, it may cause allergic reaction, maybe fall in the blood pressure, or maybe rarest of rare, it can cause anaphylactic shock.
Okay. Okay.
Now, how to assess that? See, whenever we look for the clinical data, preclinical data, and then you assess the risk versus benefit. And we know that both the vaccines which have been introduced so far in our program, they are very, very safe. I will not use word absolute safe. There nothing is absolute safe in the word, but very, very, very safe. And we know that what are the possible adverse reaction which can happen, and therefore there is a mechanism, one, to identify that yes, this can happen, and this is how you can identify. And then there is a system by which we do what is called as a causality assessment mechanism. Means you assess the cause because of this. Somebody may die even because he met a road accident. Even that is reported as adverse event after immunization. But this adverse event not necessarily mean that this is because of the vaccine. I'm just giving an example. There may be a person who is suffering from cardiac disease and he dies because of the heart attack, but because he is taking vaccine, this will be reported as an adverse event. So media should be very careful in reporting this as an adverse event, not adverse reaction, not adverse action happen because of the vaccine. And that is what I must tell you very importantly. That is what we do as a National Scientific Coordination, our coordinator, our entire pharmacovigilance system is to train people how to identify the adverse reaction versus adverse event which is unrelated to the investigational or intervention. So that is very important. So there are certain things we expect from the vaccine which may happen in some population, in rare population, in very rare situation. And important thing is the management or immediate intervention is possible. And that's why you have all the system in place. So no reason to be afraid of taking vaccine. No, absolutely no reason to be afraid or no reason to be apprehensive.
Right, right. Absolutely. Many thanks, Dr. Vaikom Gupta, for your opening remarks. You are National Coordinator of Pharmacovigilance Program of India, which of course is responsible for training and responding towards a drug safety program. Now, let me go off to Dr. Rana A.K. Singh, who's Medical Superintendent RML. Sir, as you talked about like how you underwent the mass immunization program, now it also gets important to impart or to educate people about it. And as we have seen that there, a bit of concentration is also to allay any apprehension or doubts about the vaccine. So Dr. Rana A.K. Singh, as Dr. Vaikom Gupta just mentioned that having adverse effect is fairly common, and it happens with every drug. What are the mechanisms in place at your hospitals? Let's start about educating people or the recipients of vaccine as to what will happen and what they should be careful about.
You see, we have made a very rock solid arrangement at my institute. We get the list of beneficiary from the district office,
Okay.
and simultaneously the beneficiary also gets a SMS on their registered mobile number that they have to at RML Hospital Center for vaccination. So to begin with, when our beneficiary comes, first we make them sit comfortably for a small amount of time, so that that anxiety level or whatever is going on in the mind, that is allayed. That's an automatic process. Then they come to the registration counter where we verify the identity of the person. They'll have to, we see one document for identity verification. Thereafter, we give them the vaccine. Giving the vaccine or vaccination or vaccinator, these words, they sound very, like very big words. But giving vaccine is nothing. It's all about giving an intramuscular injection. जैसे वो हिंदी में बोलते हैं कि मांस में एक इंजेक्शन लगाना है. So it's all about giving an intramuscular injection. Doctors, nurses, we do it day in and day out. It's a very, very simple procedure for us. Once the vaccine is given, then we have got two nurses sitting right there. They will brief the beneficiary after vaccination that, look, you have got the vaccine and the vaccine will generate immunity in your body. But those corona appropriate behaviors which we have been following for last 1 year, we should continue to follow that. And there is not a great deal, like wearing a mask. Wearing a mask, it does not only protect you against corona, it protects you against n number of, like airborne diseases, say tuberculosis, there are many more. So that's a kind of, collateral benefit of using a mask. Hand sanitization, again, a very simple thing. Hand sanitization is nothing but to keep your hands clean. And if you keep your hands clean, it does not give you protection against the corona. It gives you protection against a lot of germs entering into your intestinal tract and causing disease, say cholera, dysentery, typhoid, worm infestation. There is a long list. So if you are using hand sanitization, it protects you against a lot of more diseases apart from corona. And then social distancing is again not a big deal. So we tell them that continue to practice them even after you have been vaccinated. Now we have got observation area where we make the beneficiary to sit for half an hour. In that area, we have got group of nurses and anesthetists. They are literally patrolling in that area like police, so that if somebody has got some problem, they are not dependent on the feedback of the beneficiary telling them that I have this problem, I have that problem. Because we are professionals, so we can, pick up or we can make out that, X person has got some problem. So then we will take preemptive step. In the same area, observation area, we have got a resuscitation arrangement for resuscitation. If some adverse reaction happens, and believe me, if you can, that resuscitation area is practically, I've got everything. It is practically like a one-bed ICU setup. I've got all kind of equipments there to deal with if somebody gets any kind of problem. We have got defibrillator, which is used to start the heart in case it stops. I'm not saying that I was expecting any one of them. I have got a ventilator there. I have got oxygen supply there. I have got a crash cart. Crash cart is a small cart on which all life-saving drugs are stacked, properly labeled, so that if you need them, you don't have to, fiddle out from a bunch of injections that which one. So we've got a crash cart there. We have got